Hello friend, in this video I will teach you ECG under following headings. What is ECG? That is definition of ECG, calibration or normal measurement of ECG, standardization of ECG and 10 steps to interpret ECG. So let's start. ECG or electrocardiogram. Electro is for electrical, cardio is for heart, and gram is for graph. So graphical representation of electrical activities of the heart. Calibration of ECG. This is ECG strip. X-axis represent duration denoted in millisecond. Y-axis represent voltage denoted in millivolt. ECG strip consists of large square or large boxes and small square or small boxes. One large square contains 25 small squares. One small square is equal to 1 millimeter, so one large square will be of 5 millimeter. Similarly, one small square is equal to 0.04 second and one large square is equal to 0.2 second. Similarly, one small square is equal to 0.1 millivolt, so one large square is equal to 0.5 millivolt. Standardization of ECG. When you take any ECG paper in your hand, first thing is to check its standardization. It is denoted by a bar-shaped symbol usually present in left corner of ECG paper. The amplitude of this symbol is two large boxes in y-axis and duration is one large boxes in x-axis. Steps to interpret ECG. These are rhythm, rate, axis, P wave, PR interval, Q wave, QRS complex, QT interval, ST segment and T wave. First step is rhythm. This is ECG strip. Take a piece of paper and puts line on it. Then measure R to R distance. If RR wave are equidistant and P wave is followed by QRS complex, then this is normal sinus rhythm. This is another ECG strip. Measure R to R interval. If R wave are not equidistant and there is identifiable P wave before QRS, then this is regularly irregular rhythm, seen in second heart block or Mobitz type 2. This is another ECG strip. Measure R to R interval. If R wave are not equidistant and there is no identifiable P wave, then this is irregular rhythm. Second step is rate. When a rhythm is regular in this ECG strip, when two R wave are single large box apart, then the rate will be 300. If two R wave are two large boxes apart, then the rate will be 300 divided by 2, 150 beats per minute. If R wave are three large boxes apart, then 300 divided by 3, which is equal to 100 beats per minute. If R wave are four large boxes apart, then 300 divided by 4, which is 75 beats per minute. So formula is 300 divided by number of large boxes between RR waves. When rhythm is irregular, then a rate is equal to number of R waves in 6 seconds multiplied by 10. For example, in this ECG strip, there are 9 waves in 6 seconds. So rate will be 9 into 10, which is equal to 19 beats per minute. Third step is axis. For axis, we use lead 1 and AVF. In this ECG strip, lead 1 R wave is upward and also in AVF R wave is upward. If in both lead 1 and AVF R wave are upward, then this is normal cardiac axis. In this ECG strip, in a lead 1 R wave is downward while in lead AVF R wave is upward. This is seen in a right axis deviation. Mnemonic is right return. In another ECG strip, in a lead 1 R wave is upward while in AVF it is downward. This is seen in left axis deviation. Mnemonic is left leaf. Step 4 is P wave. For P wave, we use lead 2 and lead V1. The normal height of P wave is less than 2.5 mm in lead 2, while 1.5 mm in lead V1. The width should be less than 0.12 second. In this strip, the height of P wave increased, which form this shape. This is called P pulmonale and is seen in right atrial enlargement. While when width of P wave increase, this form M shape. This is called P mitral and is seen in left atrial enlargement. Step 5 is PR interval. It extends from the beginning of P wave to the beginning of QRS complex. Its normal duration is 3 to 5 small square, that is 0.1 to 2.2 second. In this ECG strip, PR interval is reduced. This is seen in WPW syndrome or Wolff-Parkinson-White syndrome. In this strip, the PR interval is increased. This is seen in first degree heart block. In this ECG strip, PR interval is depressed. This is seen in acute pericarditis. Step 6 is Q wave. Normally, Q wave is less than 2 small boxes. When greater than 2 small boxes, it is always pathological and shows old or current MI. For example, in this ECG strip, Q wave in lead V2, V3, V4 is pathological and shows interior wall MI. Step 7 is QRS complex. Normally, duration of QRS complex is 0.08 to 0.12 second, that is 2 to 3 small squares. In narrow QRS, duration is less than 0.08 second and seen in atrial flutter, atrial fibrillation, and junctional arrhythmias. Broad QRS when duration is greater than 0.12 second and is seen in ventricular arrhythmias and bundle branch blocks. In narrow QRS complex, for example, in this ECG strip, there is sawtooth flutter waves between two R waves. This is seen in atrial flutter. This is another ECG strip in which there is no identifiable P wave because it is buried in QRS complex. So this is junctional or nodal tachycardia. This is another ECG strip in which there is no identifiable P wave and irregularly irregular R waves. So this is atrial fibrillation. In broad QRS complexes, for example, in this ECG strip, there is wide and basal QRS complexes and all QRS complexes are identical. This is ventricular tachycardia. In this another ECG strip, there is wide QRS complex and abnormal morphology with discordant ST segment and T waves. This is seen in ventricular ectopy. In this another ECG strip, there is no P wave and no QRS wave can be identified and it's totally erratic tracing. So this is ventricular fibrillation. Broad QRS complexes with bundle branch blocks. In a right bundle branch block, M pattern in lead V1 and W pattern in lead V6. Mnemonic is marrow, where M shaped in V1, W shaped in V6, and RR is for right bundle branch block. Whereas in left bundle branch block, W pattern in lead V1 and M pattern in lead V6. Mnemonic is Valium, where W shaped in lead V1 and M shaped in lead V6. And LL is for left bundle branch block. Step 8 is QT interval. QT interval extends from the start of Q wave to the end of T wave. Prolonged QT interval is seen in antiarrhythmics, antibiotics, antipsychotics, antidepressants, and antiemetics. Mnemonic is A, B, C, D, E. While a short QT interval is seen in short QT syndrome, hypercalcemia, and opener of potassium channel, that is pinacidil. Step 9 is ST segment. ST segment is a isoelectric line between S wave and T wave. ST elevation is seen in STEMI, that is ST elevation MI, and acute pericarditis, as shown in this ECG. STEMI or ST elevation MI in different leads of ECG. ST elevation when present in lead 1, AVL, V5 and V6, its lateral wall MI. ST elevation when present in lead 2, 3 and AVF, then it is inferior wall MI. While when ST elevation is present in lead V1, V2, V3, V4, then it is anteroseptal wall MI. ST depression. As this ECG shows ST depression, it is usually seen in NSTEMI, that is non-ST elevation MI, myocardial ischemia, and posterior wall MI. Step 10 is T wave. T wave is upright in all ECG leads except AVR and V1. In this ECG, peak T wave is present. This is seen in hyperkalemia. In this other step of ECG, hyperacute T wave are present. This is seen in early stages of ST elevation MI or STEMI and Prinzmetal angina. Inverted T wave is this ECG shows inverted T wave seen in bundle branch block and left ventricular hypertrophy. So guys, if you have to interpret any kind of ECG, then used all these steps so that you never missed any pathology. And one thing more, if you like the video, then please consider subscribe the channel and click on bell icon to get updates regarding our new videos. Thanks for watching.